Thanks for coming out here to the Reby Skin Clinic and giving me an opportunity to tell everybody the new varicose vein treatment center that we have established. This has been over a year in setting up. We have one of the finest varicose vein centers in Northwest Iowa, if not the finest. Some of the latest in technology. We have the finest diagnostic equipment. Some laser treatments that are available now make the old vein stripping procedure obsolete. We can do an evaluation in this clinic and find out whether or not your varicose veins are treatable. We do file insurance now at the Reby Clinic. We can do an analysis to determine if your insurance company will cover your treatment. We also can do all ranges of treatment for varicose vein here at the Reby Clinic. We can do sclerotherapy, which treats medium-sized veins. We have the lasers, which we've demonstrated in the past to treat the small veins, and we now have the endovenous laser procedure to treat the very large, ugly, rope-like veins in the legs. So we're quite excited about being able to offer this treatment to everybody. What I'd like to demonstrate now is just simply the importance of vein mapping. When you have varicose veins, we have to determine where the veins are damaged, where the valves are broken, and to do that we do a diagnostic ultrasound. The ultrasound doesn't hurt. It's a very simple procedure, but can be complicated to interpret, and we use the ultrasound to find your varicose veins. We take the veins and try to demonstrate on the ultrasound whether or not the veins are damaged. This here is a very superficial leg vein, and I'm going to switch the ultrasound and now try to analyze the blood flow through that. We will simply squeeze the leg to get the blood to flow. Blue blood is really good blood, and red blood is shows that there's a problem with reflux. This blood vessel, surprisingly enough, does actually reflux, and this is going to call for further testing and a more complete diagnostic map. Varicose veins run in families. People that have family members with varicose veins or family members that have had vein stripping in the past are at very high risk for this. These veins are easy to treat before they cause a lot of symptoms. Once they get extremely symptomatic, they're much more difficult to treat. We do the diagnostic imaging. We then generate a vein map. The map we use gives us a strategic approach to creating the image. We save the image and then use this to plan our treatment strategy so that we can treat the varicose veins. Fixing the varicose veins, this top-down philosophy is much like patching the ceiling. If you're going to patch the ceiling because there's a water leak upstairs, you've got to turn the water off upstairs before you patch the ceiling. The same thing applies to varicose veins. If we start at the top, work our way down, we'll get the best results with the least chance of having the vessels return. Once the veins are identified as abnormal and the valves in the veins are broken, the old treatment used to be vein stripping. The vein stripping would require sometimes up to 30 incisions in the leg, and the veins would be cut out or pulled out of the tissue. Now with the laser, we can very simply start an IV in the vein that's abnormal. Through that IV catheter, we run a laser fiber. The laser fiber is run all the way up the leg to the top of the vein that's abnormal, and then using a very precisely computer-controlled laser energy, we turn the laser on after numbing up the leg, and we pull the laser fiber out very slowly, basically causing the vein to glue together from the inside on itself. It's all done under local anesthesia right here at the Reby Clinic. One of the most important parts of complete vein care that we offer at the Reby Clinic is a procedure called sclerotherapy. We do sclerotherapy in several forms. One is we use the ultrasound. With the ultrasound, we identify the veins and then use very fine needles and inject into the vessels into the blood vessels a material that actually causes them to glue together from the inside. The sclerotherapy procedure is done both with the ultrasound and also with our vein light. Using the vein light, we can easily identify veins close to the surface that are going to cause a problem later on or are probably causing a problem now. We can inject into those vessels a material that causes the veins to close up. The material is sodium tetradecyl sulfate, and it behaves very much like soap or a detergent. We actually create a foam with it. We inject the foam into the veins, pushing the blood out of the veins. It irritates the lining of the blood vessel and causes the vessel to glue itself together as it heals up. If you have varicose veins or know somebody who has varicose veins and they need to be treated, they should be treated before the problems that are much more difficult to take care of occur. Please come into the Reby Clinic. We'll be happy to take a look at you. If you don't have varicose veins and only have cosmetic issues, we can identify those as well, and we're perfectly well set up to treat the very tiny spider veins, the medium-sized blue reticular veins, and the very large rope-like varicose veins. So please stop in at the Reby Clinic in Okoboji, and we will be more than happy to take a look at you. Thank you.